Hi, I'm Dr. Raymond Zakhari, psychiatric nurse practitioner, and I'm going to give you a quick primer on this thing we call a capacity evaluation. So let's talk about capacity. This is a structured way to determine if a patient can make a specific decision at a specific point in time. Capacity is task specific, it's not global. It can fluctuate, and the goal is to simply maximize the patient's autonomy while promoting their safety. So capacity is not an all or nothing situation. A patient might have capacity to refuse a flu shot, but not to manage complex insulin dosing, right? So we assess capacity through 4 domains: understanding, appreciation, reasoning, and communication. So think of them as building blocks. Understanding is foundational, and it's the concept that the others build upon. So here's the quick roadmap. Understanding. Do they grasp the facts? Appreciation is, do they see how those facts apply to them? And reasoning is, can they weigh the options and consequences? And finally, communication, can they express a consistent choice? So I'm going to go through each of these one at a time. So tell me in your own words what your condition is. What treatments were discussed? What are the risks and benefits? If they can't tell you back, then they don't understand. And without understanding, none of the other domains are going to hold. This can be the situation in a case, say, like delirium, dementia, or even acute anxiety can impair this domain. So always rule out those reversible causes first, because capacity may be restored if they can develop understanding. Now, this is where psychiatry lives. Appreciation. This means, do they understand not only what is diabetes, but then they deny they have it and they say that chart's not mine? Well, that's a failure of appreciation. So questions to assess this domain would be things like, do you believe you have this condition? Or how might treatment affect you personally? What we're looking here is that insight and emotional integration, because those are the key factors as they relate to appreciation. A loss of appreciation is the most common capacity deficit domain in psychiatry. Now, let's get to reasoning. The question here is, how did you decide between the options? What are the main pros and cons for you? What needs to change in order to affect your decision? You're looking for logic that's consistent with their values, not whether they agree with the decision that you would like them to make or not. So depression and mania are often things that can distort reasoning. They may have nihilistic logic, so nothing will help, right? Or they may have grandiose logic. I don't need meds, and this will signal to you impairment, right? If they think they're invincible or they think things don't apply to them that apply to the average person. So that can affect their ability to reason. And the final domain is, please state your choice. See, you have to have an ability to communicate, and it needs to be consistent over time. So has it stayed the same today? Who should speak for you if you cannot? Even if the first 3 domains are intact, understanding, reasoning, and appreciation, aphasia, delirium, and catatonia can block this reliable expression. So you're also assessing for consistency and stability of choice. If they can't communicate it, then they don't have capacity. So here's the shortcut you can use. So teach back for understanding, tell me in your own words. Personal impact for appreciation, how does this affect you? And then compare the options for reasoning. How did you weigh the choices? And confirm the choice for communication. What's your decision today? If any domain is impaired, treat the reversible cause, simplify the information, and reassess. But all 4 domains must be met in order to have decisional capacity in that specific instance. So the key thing to remember here is that capacity is decision specific and time sensitive. One failed domain does not equal a global incapacity. So you need to support them first, then decide. And then, of course, document the questions, answers, and reasoning. And always remember, the ethical goal isn't control, it's to support their autonomy within the patient's cognitive limits.